Our primary goal for the program's launch is to cultivate a cohort of nursing students who are practice ready and successful on their national licensure exams. And I'm really excited over the next couple years to be able to build a team that shares that vision. I feel like I inherited the nursing gene. My grandmother was a caregiver and my mom was a nurse. When I got into nursing school, I realized that nursing was my calling. I love the intimate relationships that nurses make with their patients. For 27 years, I've been a registered nurse and an advanced practice nurse, and I've worked primarily with pediatric patients and their families. I've done everything from take care of neonates in the neonatal intensive care unit to taking care of older children and their families in inpatient and outpatient settings. About 15 years ago, I made the switch to nursing education, and I've taught in undergraduate and graduate nursing programs. I've taught classes such as pathophysiology and pediatrics, global and community health. A lot of things attracted me to this position at Meredith. It's exciting to be able to think about building a team and launching a nursing program from scratch. I also love Meredith's focus on preparing professionals and nurturing strong women. So I get to bring my background as a nurse educator and my experience as an academic leader to really prepare strong nurses here. My philosophy as a nurse educator relates back to my role as a nurse. And nursing is a very humanistic approach as a profession. We really take into consideration the whole patient, not just the illness. That means that as a nurse educator, I'm concerned about the nursing student as a whole. I'll use active learning strategies to develop the cognitive piece of nursing, but I focus on things like reflection and debrief to develop that affective aspect of nursing. We deal with some really difficult topics in class and have difficult clinical experiences, so it's really important for me to curate a safe learning environment. Meredith's nursing program is going to be unique on several levels. We're going to get to take advantage of Meredith's strengths. Students will get individualized advising, mentoring, small classrooms, and the opportunity to practice in clinical settings. Our curriculum is going to include over 600 hours of time in the lab and clinical simulation. And this not only prepares them to know clinical skills, but it also helps with clinical judgment and critical thinking. Our learning spaces for our students are going to include all of the areas that they could practice in. So we have simulation spaces that will look like outpatient settings, inpatient settings, a home setting, and telehealth. Our students will also have the opportunity to study abroad. The 3 values that our program will prioritize would be compassion, integrity, and social justice. Compassionate care is going to be the baseline of your nursing practice, and that includes active listening and empathy and understanding the patient as a whole. Our profession is the most trusted profession and has been for many years, so it's really important for our students to develop an ethical practice and have integrity. And then as far as social justice goes, it's our responsibility to advocate for patients and ensure that there is equitable distribution of healthcare resources and that we're trying to mitigate some of those healthcare disparities. Our curriculum is going to use things like clinical practice and case studies and reflection to help our students develop those critical attributes. I would like the Meredith alumna to know what an honor it is to be able to start the nursing program here. I have this overwhelming sense of gratitude for all of their support. I don't think folks know how many Meredith grads have gone on to become nurses, and they've reached out via email and offered to help in a variety of ways, like lecturing in class or precepting or mentoring. We've had Meredith alum that have supported us through donations and making scholarships, which is really going to be impactful for our nursing students.